talk tough. Discussing issues of national concern. One full hour of patriotic discussion with David Kuti. This and every Friday, exclusively on LN TV. Flashpoint, Liberia is getting better.
Well, thank you very much and good morning to everybody. This is Flashpoint, the voice of the coalition, and I'm David Kuti. As you may be aware, on every Friday we are here for the program Flashpoint, starting at 10:30 to 11:30, 1 hour. And the repeat of this program is on Sunday evening at 8. And so today, we are here again with another medical doctor. 2 weeks ago, Dr. Helen Reed came here to talk about acupuncture. And today we have Dr. Narayan Perry, head of the Liberia Eye Center at the JFK, and faculty chair of ophthalmology. And he's also the vice chair. Oh, let me get this clear. Liberia College you're also the vice chair. I mean the chairman.
I'm the faculty chair.
Faculty chair. Okay, fine.
Ophthalmology.
Okay.
At Liberia College of Physicians.
All right. I got a mistake in here, but thank you for the correction. Dr. Narayan Perry is the head of the Liberia Eye Center at the JFK. He's also the faculty chair of ophthalmology. You know, ophthalmology has to do with the eyes at the Liberia College of Physicians and Surgeons. Welcome again to Flashpoint, sir.
Thank you, Mr. Kuti.
Fine. I was watching your first appearance here with me, and it was excellent. And today, I hope those of you who are out there will listen very carefully. As you may be aware, your eyesight or the eyes are very important to the body. And those of you who don't take it serious, man, that's it, you're out. I think I gave you some examples the other time. I know about a lady who asked for divorce because she could no longer stand taking her husband to the bathroom. She could no longer stand being hungry because her husband was not able to go out to work anymore to bring food home. And she felt that that thing she said during the marriage or the wedding until death do us part was no more working. And so she had to put in for divorce, and she left. Because of one thing, the man went blind completely because he did not know that he has something called glaucoma. Dr. Perry will tell us more about glaucoma today, but I just want to let you know that if you're sitting there and you don't go to the hospital to check what's wrong with your eyes, you know, in the Western countries, America, Germany, other places, like even India, where they have very good doctors, I know that people go for checkup. Not only for the eyes, for the entire body. But here, we only go to the hospital when we are sick. When something gets into the eye, the water coming down from the eye, then you go to see the eye doctor. Stop that. Dr. Perry, welcome again to Flashpoint.
Thank you, Mr. Kuti.
Thank you. Okay, we're discussing glaucoma today. Glaucoma is one of the most dangerous illnesses that make people blind. First, please tell us what is glaucoma.
So glaucoma is a condition where the eye pressure increases.
Okay.
All of us know that there is something called as body pressure or blood pressure. Whenever you go to any clinic, that is the first thing that they check.
Okay.
Similarly, there is something called as eye pressure. So whenever eye pressure goes beyond the normal limit, which is 20 millimeters of mercury, it can affect the health of the optic nerve. Optic nerve is the connection between the eye and the brain, and when the pressure is in excess, the optic nerve loses its function slowly. So this condition is called as glaucoma.
Okay. You are saying glaucoma simply means pressure in the eye. You are also saying that the body pressure is different from the eye pressure.
Yes.
Now, what is the Okay, like for example, the body pressure is normally between 120 and 180. 120 and 80. When you get an order, it goes a little higher, 135 over this. Now, what's the normal pressure supposed to be for the eye?
For the eye, normal pressure should be between 10 to 20 millimeters of mercury.
10 to 10, 10 to
10 to
20.
20. Some people say 21.
Yeah.
Anything more than 21 is abnormal.
It's abnormal.
Yeah.
So when you go to the hospital and you check your eye pressure, your body pressure, for example, and they tell you your body pressure is 150 or 190 or 200, you are in trouble. Now, Dr. Perry is saying also that when you go to the hospital, the JFK, for example, where I would recommend anybody, when you get there and they tell you your eye pressure is 22, you are in trouble.
Yes.
It is abnormal.
Yes.
It is not normal.
It is.
All right. All right. Who gets glaucoma?
So glaucoma is basically age-related disease.
Oh, age-related.
Yes. As the age increases, anybody is at risk of glaucoma. So for the Western or Asian population, we generally say that anybody above the age of 60 is at risk of developing glaucoma. But from what we have seen here in Liberia, we would say that anybody above the age of 40 is at risk of glaucoma. So aging is the most important risk factor. The second risk factor is heredity. If somebody in the family has glaucoma, there is a 10 times more risk for the immediate family members, that is either the children or siblings, they may have glaucoma. So heredity plays an important role.
Then that's a dangerous part.
And the third important risk factor is the African race. African race is genetically predisposed to developing glaucoma and an aggressive form of glaucoma.
Let me get that again. You said African race.
Yes.
What do you mean by that?
I mean, anybody who has an African ancestry, one of the parents who have been born in Africa, they are at risk of developing glaucoma.
Why is that?
Well, there is something in the genes over here.
Yeah.
People have done several studies to find some unique genetic mutations that are found in these people. And even in Africa, there are certain tribes which are more predisposed, so it's a lot to do with the genes.
Now, if that's the case, if it is hereditary, if your father or uncle had it, which means you will somehow have it, if that's the case, is there a cure? Is there a way you can help yourself? I will come to the cure part. I'm not talking about cure yet. I'm going to ask you whether there's a cure for glaucoma. But what I'm saying is that if my grandfather had glaucoma, and it came down to my father, and it came down to me, are you telling me that no matter what I do, I can't do anything about it?
Well, we inherit genes from our parents, and there is no choice for it.
No choice.
No choice. So likelihood is more. So the only thing we can do is early detection and treat it on time. But there is no way to cure it. Like if you are saying, can we do any genetic treatment, something of that sort? No, it's too early to say anything. People are still working on it.
Okay. Now, if that's the case, is there any cure for glaucoma?
Glaucoma cannot be cured, but it can certainly be treated. It's something like diabetes. There is no cure for diabetes. One lives with diabetes till the end of his or her life, but it can certainly be kept under control using medications. So same story with glaucoma too.
Okay. Well, I think I'm a witness to that. I'm a witness to that. On the 1st of February 2022, you, Dr. Perry, did my operation on glaucoma. You first of all did an operation to remove the cataract. Then you did the operation for me for glaucoma. Well, you advised me on something. You said, well, you got to come back tomorrow. Let's remove the plaster. I did that. When I got there, you said, come back in 1 week. I did that. After they said, come back in 3 weeks' time, I did that. And every time I went there, you did a normal routine, checking from one to another. You were the last person I always met. But one advice you have always given me is to continue taking my medication.
Yes.
And that is what I have always done. So that's your advice. It's not curable, but it can be controlled.
Yes.
Only if you take your medication.
Correct.
What advice do you have for people who don't go to the hospital or to check? What advice do you have for them? There are some people who don't care. Okay, let me give you this. People come to my place for wedding receptions. They ask me to use my yard for wedding reception. There was a time I saw a lady taking some nice pictures. Oh, I look good, I look good. My eye is beautiful. I asked her one question. Are you sure your eyes are beautiful all the way? They're looking good out there, but are they good inside? You are the computer people. Every day, Facebook. Do you sometimes check the husband? And no, that's what you need to do. What advice do you have for people like that who don't care? They play with the computer every day, but they don't care to check the eyes one day until something happens. What advice you got for them?
Well, there is a proverb which says, "A stitch in time saves nine."
A what?
A stitch in time
A station time.
saves nine.
I like that.
Yeah. And especially in a resource-limited country like ours, it's very important that we find out things earlier, because once we diagnose a disease at an advanced stage, no matter what we do, it is very difficult to control.
Yeah.
Majority of the patients that we see with glaucoma in the clinic, they come at an end stage
Yeah.
when they can see nothing, and there is nothing we can do to restore their eyesight.
Okay.
So taking this message, I think everybody should take it seriously. All those who are above the age of 40 or 50 years, to check their eyes once a year as a routine.
Yeah.
Yeah, it's just like
Even if it is possible twice a year.
Sure.
Yes.
Sure. Yeah.
Even if it is possible. Dr. Perry is saying that you should do it once a year. And I'm just saying, if it is possible, twice a year. Go and check your eyes. You don't know what's happening down there. Now, we are on glaucoma today, but tell me a little bit about a cataract. What is that thing called cataract? What does it really do?
So cataract means clouding of the natural lens in the eye.
Okay.
Like the eye is like a camera that we use to take pictures. There is a lens inside which focuses the light on a film, and that's how the camera works.
Okay.
Similarly, we have a natural lens in the eye. God has gifted us with a beautifully designed lens. But as the age increases, this lens becomes opaque, and that is called as cataract.
Oh.
The only cure for cataract is to do a surgery and implant an artificial lens in that place.
Okay.
Yeah. So
And that artificial lens is there forever.
yes, it lasts forever.
Forever.
Yes.
Like my own.
Yes.
Right.
Mr. Koti?
Yeah.
I would like to make one point here.
Yeah, okay.
Like we just talked about the eye checkup once a year or twice a year. But what is an eye checkup?
Okay.
That's an important message that people need to understand.
Yes, let's go to that.
Say many of us go to just some optical shop,
Yeah.
get our eyesight checked. They put on some glasses, we see good, and that's the end of the checkup. Or some people even they just buy over-the-counter glasses for reading, and they say good, and they feel that no, that's all about my eyesight. I can see good, that means everything is good. But that's not true.
Okay.
That's not true. Let me give you an example. Like recently, we had one doctor who came for checkup. For sake of privacy, I do not want to disclose.
No, you can't call.
details. But the doctor just came saying that my glasses are broken. I just need to change my glasses.
Oh, doctor.
Then I said, ma'am, the doctor, like it's not advisable to just change glasses. I would suggest you to go for a complete checkup.
Yeah, complete checkup.
Then the doctor asked, like, what exactly does a complete eye checkup entail? Then I said, we need to check your vision, we need to check your glasses, we check your eye pressure, we put some drops, we see you after 1 hour, check the back of the eye, we see you with a magnifying lens, we call it slit lamp. We do all of that.
Yeah.
And after doing all that, for that doctor, we ended up having a diagnosis of glaucoma.
Can you imagine that?
The doctor himself had no idea that glaucoma was slowly brooding inside. The good part was that we picked it up at such an early stage that now, if the treatment is taken regularly, the chances of losing vision are complete eye checkup.
Yes.
Eye checkup doesn't end with wearing glasses.
No.
There is a lot more that goes into checking the eyes.
Yes. That is very important, doctor. As I keep saying, I'm a witness. Those of you who want to check your eyes, please go to the JFK. I'm not saying it because Dr. Perry is sitting here. We have been to places, and I can tell you, when you are going for the checkup for the first time at the JFK, please be prepared to stay for not less than 3 or 4 hours. The reason is very simple. They're not just going to take flashlight and put it in your eye and say, show me, how many fingers do I have here? And they say, oh, what letter is it? A, B, C, D. And after that, they give you glasses. No. I have been to the JFK 10 times more or more. You have to go from one stage to another. That is what they call a complete checkup of the eye. As he said, it's not a checkup. Eye checkup is not giving you glasses at the end and then you are okay. No, 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 no. You just heard a story he gave you about a doctor, a medical doctor. We're not going to call names here. We're not going to tell you whether it's a man or woman. But that person just wanted to change glasses. Hey, the Dr. Perry said, no, we have to do a complete checkup. And what did they find out? They found out that she or he had glaucoma in the end. So that's the difference. I give you another story about another friend of mine. He's a former minister. I'm not going to tell you the ministry. I met him at the JFK. I went and sat down by him. He had a dark shades on. He did not recognize me. I didn't recognize him. He had a cap on with dark shades. While sitting there, somebody called my name. David Coty. I said, yeah, that's how he looked. They said, oh, Coty. I said, yes, man. I said, okay, then I called his name. He called his name. I said, oh, good to see you. And that man gave me a pitiful story about telling me that he had only 1% eyesight. Only 1%. Which means he's been going from place to place and nobody told him the truth. There was no proper check. They just did anything and said, go. When he got to the JFK, it was late. Only 1%. So please go to a good place for your checkup, not just anywhere. Apart from that, all right, let me ask my next question. We'll come to more examples here. What are the symptoms? What are those things that we need to watch out for? That when we see, then we know we are approaching the stage of glaucoma or any other illness. But before you answer that, the program you're following this morning is Flashpoint, the voice of the coalition, and I'm David Coty. Those of you who have been watching the program on Sunday night, please don't call. I have the headache. Sometimes I use the station number, sometimes my own number. I have to keep answering call. No, this is a repeat. Don't call, it's a repeat. Now we're going to be taking calls very soon, but only for this morning, Friday morning, Sunday night, don't call. If you call, well, I'm not going to be rude. I will pick up my phone and say, oh, thank you for calling, but this is a repeat. Sometimes they want to call to ask questions, but they don't know it's a repeat. Yeah. Now, what are those things that we're supposed to watch out for? That when we see, then we know we are facing trouble in the case of glaucoma.
So glaucoma is called as a silent thief of vision. So glaucoma,
a silent what?
Silent thief.
A silent thief?
Yeah. So it robs of your vision without your knowledge.
Can you imagine that?
Till a late stage, and a stage when you actually realize that you can't see well, it's too late.
It's too late.
So the only way to find out whether you have glaucoma or no is to go for a yearly eye checkup,
yes,
even if you don't have any problem. So it is asymptomatic. That is the most common presentation of glaucoma. There are certain varieties of glaucoma.
He just spoke a big word. It's the what do you say?
Asymptomatic.
Yeah, that means there's no sign, no symptoms.
No symptoms.
You don't. It's not like malaria where you would be feeling feverish. You guys be feeling warm. No, glaucoma doesn't do that. That's what the doctor is saying. So no signs, no symptoms.
Sure.
So the best thing you can do is to just check the hospital. Yeah. All right. Thank you very much. Go ahead, sir.
But there are a few varieties. Say about 10% of cases, they may have eye pain, redness.
Okay.
They may see once in a while colored halos around the lights. That means when they look at a focused source of light,
yeah,
they see a rainbow of colors around it.
Okay.
Glaucoma can affect even small children. Some babies can be born with glaucoma, and such babies may have enlarged eyes. Their eye may look cloudy. The clear portion of the eye, different portion, we call it cornea, it may look cloudy. Those babies may have watering. So these are the different kinds of signs and symptoms that the small percentage of patients may have.
I see. Now let's come to the operation a little bit. We need to educate the public on something here today. When you are operating somebody for glaucoma or cataract, do you remove the eyeball completely, work on it and put it back in the space?
No way.
No way.
We are in 21st century,
Ah, yeah.
and we practice 21st century eye care over here.
Okay.
There is no reason to remove eye.
Mhm.
Yes, there are instances where we need to remove the eye, like
You are replacing the eye.
somebody has eye cancer,
Yeah. Okay.
and that cancer puts a threat to life,
Yeah.
and that's the only time when we remove the eyeball.
Okay.
But in all other cases, there is no way to remove the eyeball. We make a small opening
Yeah.
in the eye for the drainage of the fluid outside the eye.
Yeah.
That is, in a sense, a glaucoma surgery.
Yeah.
In a cataract surgery, we remove the lens which is opaque and put an artificial piece of glass inside the eye.
Yeah.
And that would require a cut on the eye about, say, 5 to 6 millimeters at the most, and it heals by itself. I really got surprised when I heard this misconception in people's
Yeah,
mind
yeah.
initially when I came here about 4 years ago, and I'm still yet to understand where this comes from.
Okay.
Yeah, the eyeball is removed.
Yeah.
I really don't understand.
But listen to me, sir. When you get back today, please ask Dr. Fayad.
Okay.
I keep calling him Dr. Fayad, but he's a doctor to me. Ask him. About 5-6 months ago, I was sitting in. I went for a checkup, like you normally advise me. Come back this time. Like you have just told me to go back in 6 months, and I have set my timer. I'm going to go back in 6 months. While sitting in the lobby there, waiting for my turn to get in there was a discussion from somebody looking so good about how they remove people's eye and clean it and put it back. I said, madam, I have never seen that before. I have been inviting medical doctors on my program, and I have never heard that from them before. They don't remove the eyes. I said, I have done my operation. I'm here for a follow-up checkup. They did not remove my eyes to check. When they were removing the cataract, it took just 15 minutes here. They used a laser. And no pain. They just give you, they numb the place and they just do your operation. They don't remove the eyes. She tried to argue with me. I didn't argue much. I just took my time, went to fire, called him. I said, I'm going back to the living room. To please come there, but we shouldn't go together. He will tell you the story. I said, we shouldn't go together. When I get there, then you please come. I want to ask you a question. He said, what's that? I said, there are people misleading people in the way. Men are sitting there. They're trying to get people scared. Yes, you got to come and erase that misconception. There's a man sitting there telling people that the operation of the cataract or glaucoma is done by removing the eyes. Please come and dismiss that, because there are people who are afraid, who don't want to go. I will give you the name of somebody quietly, a big lawyer. She will be coming very soon. She also was given that misinformation. I gave her the number for Fayad and the register. I'll also give you a number to a very big lawyer in this country. She'll be coming to you. She too has been given that lie, that misinformation. So when I went back to my seat, Fayad came in. When he got in the room, I said, oh my man, how you doing? Fine. So we started the topic in a different way. Then I said to her, how do you people do the eye operation here? How true is it that you remove the eye and operate? He said, no, we don't remove eyes here. The eye stays right there based on the condition. We just do the operation. I said, oh, but you are right, because I'm a witness of that. I said, I have done 2 here. I did my eye operation for glaucoma and also for cataract. Nobody removed my eyes. That place was quiet. Just ask him. So that's the misinformation. People just get up and talk about what they don't know. Even when there's no medical doctor here. Do you know that because I've invited 12 medical doctors to this program, different, for the heart, for cancer, I've invited people here. Most of them from the JFK. So when there's no doctor sometimes, when I sit there alone, I talk about what I know. I don't talk about what I don't know. That's what I do here. Thank you. I asked you a question about how it is diagnosed. How do you diagnose the case? How do you diagnose the cases?
So, now diagnosis of glaucoma is a bit tricky.
It's a bit tricky.
It's a bit tricky. It's not as simple as cataract. You put light in the person's eye and you see something white there at the center, and you say that the patient has cataract. Glaucoma is like a puzzle. You need to
It's
look
like
at
a puzzle.
it's like a puzzle. You need to look at 4 or 5 things in the eye, make sure they really correlate with each other.
Yeah.
Once they fit, that's when you make a
I
diagnosis.
see.
So as we said in the beginning, we
Yeah.
have to check the eye pressure.
Yeah.
We have to check the back of the eye.
Yeah.
We call it optic nerve
Up to now,
examination.
yes.
We need a test called as gonioscopy. You must have heard of laparoscopy on the body. A similar thing is there for the eye called as gonioscopy,
Yes.
in which we carefully check if the circulation of the water inside the eye
Yeah.
is happening properly.
Okay.
And we also do a computer test called as visual field test, which tells us how is the patient seeing on the sides. Because when we check
I
a
see why we
person's-
normally stay for 3-4 hours.
Yeah.
Because you have to do all of those checks
Yes.
properly.
Yes.
Not just putting flashlight and asking me how many fingers are here. Okay.
Because when we check a person's vision, make them read the chart, we are just checking the central vision. But as we all know, when you look straight ahead, there are a lot of things on the sides that you can see. And this is what we call as our visual field. In glaucoma, it is this peripheral visual field, or to put it in simple terms, the side vision that is lost first, and that is why people don't understand that they have glaucoma. So we need to do these 4 things carefully to establish a diagnosis of glaucoma.
Okay.
And that is why a diagnosis of glaucoma is to be made only by a doctor,
Yes.
because only an eye doctor is trained to do all these 4 things.
Yeah.
You cannot make diagnosis of glaucoma just based on one thing. Because somebody's pressure is high does not mean that they have glaucoma.
Ah.
A lot of people can have high pressure but no glaucoma.
Okay.
A lot of people can have normal pressure, less than 20, but they can still have glaucoma.
That's so strange.
Some people, they have certain changes of glaucoma at the back, the optic nerve,
Yeah.
but they don't have glaucoma.
Can you imagine that?
Some people may not have changes, but
Yeah.
still they have glaucoma.
Oh.
So it's not as simple.
Okay.
So a diagnosis of glaucoma should be made only by a well-trained eye doctor,
Yes.
experienced in the field.
Yes.
Later on, the follow-up can be done by people who are not doctors.
Yes.
But the diagnosis of glaucoma should be by an eye
A
doctor.
trained medical
Yeah.
doctor.
Because once you make a diagnosis, people live in the fear of blindness for the rest of their lives.
Yes.
If you really talk to people after making the diagnosis of glaucoma, they say, "Doctor, I'm not able to sleep for the past 2 weeks. This thought of blindness is always at the back of my mind.
Yes.
When I wake up in the morning, that's the first thing I remember."
Yeah. Blindness.
So when you say that you have glaucoma, it's just a simple sentence for you.
Yeah.
But for the patient, it's a big thing.
Yeah.
So
It's like a death sentence for him.
Yes.
For that patient.
So
yes.
we have to be very careful when we make that diagnosis. Follow-up is a different story.
Yes.
We just monitor the eye pressure, make sure it is normal. If not, we make some changes. But the diagnosis has to be established very, very carefully.
Very, very carefully. I'm learning something new today.
Sure.
Yeah. I'm learning something new today. Just because you have high pressure in the eye does not mean you have glaucoma. And sometimes your pressure is not even too high, very low, but you still have glaucoma.
Yes.
So your advice is that there must be a proper check of this glaucoma,
Yes.
where the equipment are there,
Yes.
not just anything.
Yes.
You know, there's a lady right now in India.
And let me
Yeah.
interrupt you here.
Yeah.
The most important equipment is a well-trained doctor.
Thank you. I agree with
That's
you.
the most important equipment than any other machine that you talk about.
Yes. So all of the machines can be there, but a well-trained doctor for eye must be there, not just anybody.
Yes.
So the equipment is there, but how trained are you to detect all of these things? There's a little right now in India called Linda. She went somewhere. I'm not going to call the name of the place. You know, what is happening in this country today has to stop. I think these are some of the things that some of us who are called elders of this town will be talking about. As a former lawmaker, a former commissioner, I'm a former government official. There are certain things that I'm going to be talking about. I'm not going to call names. But if those people don't stop, we'll be forced to call names. There's a lady right now in India called Linda. She went somewhere for a checkup. and they told her she had glaucoma, and they had an operation on her eye. Still, things were getting worse. She went to the OKFM. You know, OKFM is one of the leading stations here. She went there to beg for money to travel abroad because she went to the JFK. When she got to the JFK, her eye was spoiling, getting rotten, messing up. She was smelling, excuse me for the expression, around. When they took her to the JFK, I don't know whether it was you or your colleague, but they checked her. And they said to her, but madam, this is not just a normal glaucoma. You have cancer in the eye. But you shouldn't have done an operation for glaucoma. That operation that was done for glaucoma shouldn't have been done. This is pressure in, cancer in the eye. So you said the only thing that can be done now is to go abroad. And India was chosen. Right now she's in India. The point I'm making here is that I like the way you put it. It's not the equipment alone. But the best equipment is that training. That real doctor who has the training. People go for this training for many years. And some people just get up in the morning, they are doctors. You can't do that to our people. There are many people today who are going bad off, like the friend I told you about, a former minister, only 1% of eyesight now. Because places where he went, they just took the flashlight and showed me your finger. I look at my finger, how many fingers you see here? What is the letter here? And after that, they just told him you have this and treated them terrible. Now, what advice do you have for Facebook users? You know, in this country, that's the biggest thing now. Even people are on job, they no longer do their jobs, they sit in the offices, it's Facebook. What advice do you have for Facebook users, especially in the night, in a dark room?
Well, anything in excess is bad. Facebook, anything in excess is bad.
Yeah. If you eat too much, you eat overplus, it's bad.
Yes. So Facebook is nice to keep in touch with people, to know what is happening around.
Yeah.
But if you're spending too much time on the phone, especially in a dark environment, it puts undue stress on the eyes.
On the eye.
Yeah, and it should be avoided.
Okay.
Yeah, anything more than 1 hour of screen time a day is not healthy.
Okay. So, to use Facebook, people, you just heard it from one of the best or leading doctors in Liberia. This doctor is called Dr. Naraji Perry. He's the head of the Liberia Eye Center at the JFK and also the faculty chair of ophthalmology at the Liberia College of Physicians and Surgeons. So, you know who he is. He's not a Peking. That's the man we're talking about when it comes to this area. Faculty chair of the Liberia College of Physicians and Surgeons. Now, he's telling you that if you're a Facebook lover, that's not bad. Even if you are sitting in your office before the computer, at least after 2-3 hours, leave the computer a little bit and walk around. But some people take this Facebook to the big bluff issue. Even in a dark room, they're on Facebook. Dr. Narija Perry is telling you that it is dangerous. Don't play with telephone in a dark environment. How is the situation in Liberia about glaucoma? I don't know what they already talk about in Liberia. What is the situation about glaucoma in Liberia? Because you just mentioned something that we're a little bit different in Africa. So how is the situation in Liberia?
Well, in Liberia, let me say it very honestly, the situation is bad. Yeah, it's bad because we see a lot of patients of glaucoma every day in the clinic, and majority of them come in a stage when we cannot do anything.
Can you imagine that?
That means they had problem for a long time, and they did not know where to go and what to do about it. There are certain pockets in the country where glaucoma seems to be more prevalent.
Yeah.
Recently, we looked at our database of close to 8,000, 9,000 patients, and we found that there are certain areas where glaucoma seems to be more prevalent, especially in the northern part, that is the Lopa County.
Oh,
yeah.
Okay.
So, we all, by virtue of ethnicity, have increased predisposition for glaucoma. Secondly, the medications all these years have been very expensive over here.
Yes.
That's another reason. So people knew that they have glaucoma, but they could not put any
Afford.
medications because they were exuberantly expensive.
Yeah.
So looking at all those things, we procured certain high quality medications which are reasonably priced.
Yes, I know about that.
So India is now the hub of pharmaceutics.
Yeah.
So we stopped taking medicines from US or Europe, and we get them directly from the Indian companies
Yeah.
and price them very, very reasonably
I know about that.
so that the commoners also can afford
Can
it.
afford it.
And if one is unable to buy the medications, we offer them the option of doing surgery,
Yeah.
by which their chances of using medications are reduced.
Are reduced. Okay. Now, let me ask you one or two more questions, and then from there we'll open the lines for the public to participate and ask you some questions. Now, what is the Glaucoma Week all about? We hear about Glaucoma Week. Now, what is it all about?
So, World Glaucoma Week, World Glaucoma Awareness Week is an initiative by the
Oh, Awareness Week.
Yeah,
Okay.
it is an initiative by the World Glaucoma Association, which is the biggest body of the glaucoma experts in the world.
Okay.
And they started this initiative to educate people about glaucoma. So all over the world during this week, people take different initiatives
Okay.
to educate people about glaucoma. It could be a radio interview, the one we are doing now,
Yeah.
or doing some screenings in the communities, or some public lectures.
Okay.
Anything that you think is suitable for your community, you can do and make people aware of glaucoma.
And how long is this Glaucoma Week going to last? Just for this week or what?
Yeah, so it's supposed to be the whole of this week, so it's going to end tomorrow. Yeah.
Okay, what are the treatment options available at the GFK for glaucoma?
So as we just said, the eye drops.
Oh, okay.
Yeah, there are different kinds of eye drops.
Yeah.
We are in actually a good position now to treat glaucoma medically, that is by using the medications,
Yeah.
because now there are a variety of medications that are available.
Okay.
The situation has changed significantly in the past 1 or 2 decades,
Yeah.
because when we were undergraduate students of medicine, there were not so many medications, just
Yeah.
1 or 2.
1 or 2.
But now there is a whole gamut of medications
Yeah.
that are
madam.
available.
Yeah.
Secondly, these medications have become cheaper
Yeah.
because of the revolution in the pharma industry.
Yeah.
So there are good treatments available for glaucoma.
Yeah.
Now, the disease is progressive. That means as the age increases, the disease is going to progress.
Okay.
A point will come when the medications will not work,
Oh.
and that's the time to go for surgery.
Ah. Okay.
Now, even in surgery, now there is so much variety. If one doesn't work, we do the second. If second doesn't, we do the third.
Yeah.
And we never leave the battle.
Okay.
We have patients. We did surgery about 2 years, 3 years ago. Now it is losing its effect. We repeat surgery. Again, the pressure comes down. So it's an ongoing
battle.
Yeah.
Do you repeat a glaucoma surgery?
Yes, it's possible.
Oh, it's possible. Like in my case, I have done it before.
Yes.
Can I do it again?
Yes, you can.
Okay. At what stage do I have to do it again?
Well, when the pressure is not under control,
Okay.
despite using medications, then that's the time to go for the operation.
Operation.
Yeah.
Well, I'm not going to be afraid. I've been there before, and I know what you did for me. In fact, in the past, way back, it used to be over 45 minutes to do operation for glaucoma or cataract. This time, 15 minutes. Sometimes based on, I think the laser is about 7-8 minutes.
Sure.
So don't be afraid. If you're out there, go and check your eyes and see whether you can. Now, we will take a short break now by playing our theme song. It's the best theme song in the world. And right after that, then we'll open the lines for you to participate. If you want to call to take part, 0777 511 977 or 0880 514 096. Let's take a short break and come back.
When the platform is set, we talk tough. Discussing issues of national concern. 1 full hour of patriotic discussion with David Kuti. This and every Friday, exclusively on LNTV. Flashpoint, Liberia. is getting better.
Very much. We're back. This is Flashpoint, the voice of the coalition. I'm David Cote. If you are out there and you want to participate, please call the numbers 0777 511 977 or 0880 514 096. Do we have a call there? Okay, not yet. All right. While we're waiting for a call, we could proceed. Okay, let's try this and see. Hello.
Hello.
Good morning. Good morning.
Mr. Kosi, I found your program, but I want to know the money that you pay for the test.
Oh, okay. I don't know about that, and I don't think the doctor will be prepared to answer that. What you do?
Yeah.
Please get to the JFK in the morning. And when you go in there, please go there as soon as possible. 7 o'clock the latest. The reason is that that place is always very packed. Even we who are old who are there as old patients, you go let my friend will stay there for long. The place is always packed. So please go there as soon as you can. Yeah, and when you go, okay, let the doctor say something.
So sir, let me add something shortly.
Yeah.
Money will not be an issue for you.
Uh-huh.
Yeah, Liberia Eye Center run by LV Prasad Eye Institute is meant for people's benefit.
Yeah, I will let you answer that. Sure. Thank you. Good morning. Yeah. Yes.
Thank you so much for the program.
Thank you too.
I'm one of those that benefited from the services of the CFK Eye.
Okay.
Last year, I took an operation on my eye. Sorry, it's not being tested. For cataract operation.
Okay.
And before I took the operation, I'm not recognized so that we're getting
Ah.
2 years or 3 years. Everything was done like
Yes.
But
Yes.
after the operation, then very, very clear.
Oh.
But there's something that the company to get out of the access of that.
Yes.
I have a Samsung Galaxy tablet.
Mm-hmm.
When I did the operation today, I everything very clear, everything was very clear.
Mm-hmm.
Right now, when I look at the Galaxy tablet, it's red.
Okay.
One out of it is wider, sometimes shorter.
Okay.
Usually, I'm about to get you to go back from here, we somewhere around here, but
Mm-hmm.
I don't know what is that going to about that.
Okay. 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 Okay.
Yeah.
You will answer. Yeah. Okay. The side is very clear. Well, thank you. Keep listening. He will answer you. That's the good. No, you'll talk later.
Okay.
Yeah. Zero. Is there a call there? Okay. Good morning. Good. Yeah. Thank you. Please speak a little louder. Yeah. You did transplanting. Oh, cornea. Okay. All right. Thank you. Thank you. All right. Let's try just one more, then we'll go back to the doctor, then we'll come back to some more calls. Good morning. Good morning to you.
Good morning to the doctor.
Very good.
My name is Mark Doko.
Hey, the politician. Political Mike Doko.
Good morning, Mr. President.
Good morning to you.
Well, I want to ask some of the symptoms I
Okay.
experienced before coming down with blackboard.
Okay.
And basically, what are some measures one can take to mitigate it before it gets worse?
Oh, okay. Measures to take. Okay. Thank you, Mr. Doko. Today, you're not asking political questions. All right. Thank you. We'll stop here for now. Hold your calls until we answer these questions. Let's begin from the top. The first man asked, how much money does one need to put in the pocket when he's going for this check? How much money? 1,000 US dollars?
Well, we researched a lot about this pricing business. We want to run a self-sustainable model where the clinic can sustain its services. If you run purely based on donations, then every now and then you have to beg. But if you want to sustain high quality services, you need to charge people.
Okay.
So we run a 3-tier system of payment. I think this is not the place to discuss in detail.
Yeah.
But let me tell one bottom line that money is never a problem at the eye clinic at JFK for treatment.
Okay.
Whether you can or you cannot, we will do what is needed for you.
Okay.
Yeah.
Oh, that's good news. Money is not a problem there, even though for certain cases you may have to do this and do that. But I'm sure there's a small fee for registration at the desk there. I think it's around $15 or $20. So I'm not too sure. But I think you just put something in the pocket. But the doctor has made it clear that's not a major issue. You see, you have 3 different stages of operation there,
Yes.
cases. Some of them you don't charge at all. All right, some you have to charge something, but I advance something. Okay. So the best thing you can do, my dear brother, go to the JFK, and when you get there, you get all the details. But it is a place to go. When a tiger comes from under the water and tells you that I saw human beings living there in the sea, believe it because he's been there. I've been there. I'm telling you. Simple operation, no pain, and someone norming you from the beginning all the way, but there's no pain, and nobody removes your eye. It stays right there. They operate on it right there. Number 2, this man said he benefited from surgery there, and he's a good friend. I don't know him, but when I say a good friend of mine or a brother, he and I were facing the same problem. Before I did my operation, people standing by me, I had to do it this way. I'm sorry that we're not on television until tonight. I mean Sunday night. I had to do like this to see your face. Somebody standing in front of me, I couldn't see them clearly until I do something like this. But today, after my operation on the 1st of February 2002, I can see clearly now. I think I told you something. Let me bluff a little bit. I have a beautiful compound. And I could not see my own yard. My beautiful trees and my houses couldn't see them. Because the camera was blocking my view. And then this glaucoma thing was also around. But after the surgery, I went home, I was very surprised. I said, oh, but this place is like the light, beautiful all over. So I can see clearly, but he said, he has a Samsung Galaxy phone that is, I think he said, when he puts it on, one side will look, what is the problem? What do you advise for him?
Well, first of all, I really appreciate the power of observation this particular patient has.
Yes.
Not many patients are able to communicate with this clarity. And that makes our job easy. All that you need a check of glasses. A pair of glasses would solve your problem.
Okay.
Yeah, it's as simple as that.
My good friend, I don't know your name, I didn't take the name down, but if you watch television on Sunday night, you see me wearing glasses. I got it from the JFK. There you'll see, I think it's called bifocus. The bottom part is for me to read small letters. The one up there when I'm driving, see far off, long distance. So go there and they're going to advise you what to do. He says a pair of glasses. That's what you need to do. Mansera did cornea transplant. I think she said that there's some small problems. What does she need to do?
Well, corneal transplant is a different ballgame altogether. All that I would say is if you have a concern, you need to come back and see us. Yeah.
Okay. Please go back to the JFK man, Sarah. They will tell you exactly what to do. Now let's talk to Mark Doko quickly before come to the caller. Please hold on 1 minute. Mark Doko is asking for the symptom. You said it, but you still repeat it. But let's take this call quickly. We'll come to that last. Good morning. Yes. Oh, you coming, doctor too? Oh. Okay.
But the problem there is after the operation, they gave me some prescription lenses that I'm currently using. So this is the condition, personally, and that's what worries me at the end of life. I'm already using the prescription lenses that they give me for the JFK. Yeah, to correct it.
Okay.
Actually, the left was different now from the right. So right now, corrected. I see clearly, only when I look at my tablet, I see it, the form.
Okay.
One side is shorter and one side is wider.
Oh, all right.
What are you comparing?
All right.
Well,
Okay. Let him answer that. You answer that. Just one minute.
sure.
Yeah, thank you, brother. Thank you. All right. Who got a call there? Oh, it's gone off. Okay, sorry, we kept it back on so long. You who call on the Lone Star line, please call back. We still take your call. Okay, we have it now. Good morning to you. Good morning. Good morning to you. Good morning. All right. Yeah, we don't have much time now. Please go a little faster. Okay, Mr. Kelly. Yes. Yeah. Oh, you're going off, Mr. Kelly. Please call back if you can. Now, Mark Boko, he's a politician. This man is a big politician, but he's talking medicine today. He wants to know the symptoms and how it can be handled. You mentioned it earlier, but maybe he wants to do like the doctor said, please go there again. I'm there almost once or two times a month. As for me, I follow instructions. When they say come back after 1 week, I'm there. Come back after 3 weeks, I'm always there. So please go back there and see how they can check again, tell you what happened. And my advice to all of you who have not done any checkup before, I'm not disqualifying anybody else. No. But please, go to the JFK. If you want to know whether you have glaucoma or whatever, go to the JFK. Well, maybe we can ask you for your final comments now. We just got about 4 minutes to go.
Sure.
So maybe there's something that we didn't touch that you'd like to talk about.
Yeah, though we talked a lot about glaucoma, people need not go into a sense of insecurity or fear that, oh my God, what is this?
Yeah.
So just come for regular checkup once a year. That's the best way to pick it up.
Yeah.
If it is diagnosed, we give you simple eye drops. It's not like an injection of
No.
insulin that you take for diabetes or multiple tablets which are unpleasant to swallow. It is just an eye drop
Yeah.
that you need to put in the eye maybe once or twice a day.
Yeah.
And if you just do it regularly, the risk of losing vision is almost nil. And even if it progresses, there are various surgical options available.
Yeah.
So there is just no need to worry. Don't panic.
Don't panic.
Don't panic. But be careful.
Yes.
You need a regular, complete eye examination. That's the bottom line.
Yeah. The biggest medicine is do your checkup. Medicine number 2, when you're giving your eye drops to take it regularly. I take 2 different types. One is called 0.5 timolol, that is in the morning. I take that every day. The second one I think is called Tamaprost. I take that in the night. And you know what I have done? I got my alarm clock set. Oh yeah. Since I sometimes leave my house early like this morning, when I'm coming here, I wake up 5 o'clock in the morning, do everything I can do. By 5:45, 6 o'clock, I'm out of my house. So what I have done, I set my alarm clock for 5:45. Every day. Whether I'm coming to town or not, I take my eye drop 5:45 in the morning. 9 o'clock in the night, the one for the night time, I take it. My alarm is set, no dodging. And I don't wait for it to finish totally before I can go back to take some more. No. When I see that it's going low, I go and collect another set, keep it in my house. And those of you who have the habit of doing the way you want to do it, stop. There are some people who will be told to take this thing every day, and they will say, oh, the thing is expensive, the money business, I will only take it once every 2 days. No, that is not the instruction. You are not a doctor. That is not the instruction. The instruction is every day. So if you think money business, how you do it, the way you want to do it, is up to you. Then you don't blame the JFK. Thank you very much. The program has been flashback. I want to say many thanks to you, Dr. Perry, for coming again.
Thank you so much, Mr.
Yeah.
Koti.
Don't
It's a
get
pleasure.
thank you. Don't get tired.
No?
I will always call you here. You will come all the time. You always got to come to help our people help themselves. This is what we have done here over I've been around here since 2011, and this is what I've always done: invite medical doctors and other people to help the public, help themselves. So the program has been Flashpoint, the voice of the coalition, and I'm David Koti. Bye-bye.
When the platform is set,